Dr. Mayo, thank you so much for joining us for this interview. I know there have to be so many moving parts in your day. When you start your day, what are your priorities?
Well, each morning I meet with our incident command leadership team and we set the priorities together. So we track day by day the things we think are most important to solve that day. Sometimes the priorities take a few days or a week to get to, a final solution or recommendation.
Can you say specifically for Rochester Regional, how many of your staff members are positive for COVID-19, if you have that number, and how many are sick or out of work or quarantined because of this?
We do track that number, and we are pleased that the number of employees that have developed the infection is very, very low. And so we want to be sure that our team members have all of the protective equipment that they need, that they receive the medical care that they need. And so we actively follow them and support them as much as we can.
So let's talk a little bit about their equipment. Obviously, we've been following the news nationally of the shortages of some equipment. What is the current situation in your health system?
Yeah, so a number of times a day we are tallying the inventory. It changes throughout the day because we'll be distributing supplies, receiving supplies, and then we average that out over the course of a week's distribution or a month's distribution. So we really do follow this at multiple levels. So presently, I'm pleased to say that our supply of personal protective equipment is very adequate, and we're able to supply all the needs of our team members on a day-to-day basis.
Can you give everybody a sense of what things are like in the hospital treating COVID-19 positive patients? There is a wing that's treating them. How is that divided from the rest of the hospital? If it is, can you just give us a sense really logistically so we could imagine it in our minds?
Sure. So COVID-19 patients are receive what's called enhanced precautions. That's a type of isolation. What it means is that the patients that are in those rooms are approached by healthcare workers who have who wear gloves, who wear a gown, who wear a face mask and a face shield. And there are different types of face masks. If the patient is not undergoing certain types of procedures, a regular surgical face mask is appropriate. If the patient's undergoing what we call aerosolizing procedures, or procedures that may induce a cough or that may enter the person's respiratory tract, then they need a more substantial type of a mask called an N95. And so we have this protective equipment available to our staff, and then they use that as a daily interactive protective barrier. Some of the patients are in negative pressure rooms, which is a certain type of airflow, and then others are in regular rooms with these isolation precautions.
And are they centralized in certain parts of the hospitals?
Yes, some of our hospitals have specific respiratory care treatment areas. Some of our emergency departments have set that up. Some of the inpatient units are that way, and then others are more distributed, where the negative pressure rooms are not all in one wing, and so patients may be distributed throughout the hospital.
I know the numbers change daily. Can you give us sort of a roundabout of how many patients are currently being treated within your footprint?
Yeah, so in the inpatient, we've been running a very stable number, around 60 to 65 patients a day. And in the outpatient, there are more than that. Those are much more stable patients, and so they are generally followed through telemedicine services with their primary care doctor.
What is the rate of infection? And by that I mean Dr. Mendoza says that we are still possibly several weeks away from seeing the top of this thing. And what are you seeing right now?
Yes, we track the data very carefully on a daily basis. We have been in partnership with the county and with U of R Medicine to share our data analytics and our predictive models. And it's very difficult to say, because you don't really know until you look back with the retrospective perspective. I would say that Rochester and Monroe County has done a noteworthy job of flattening that curve, social distancing, and that's really important. We need to continue to do that. But the preliminary data in Monroe County suggests that that has been effective, and that if we continue to do that, we will receive ongoing benefits.
If we could talk about testing, what capacity are your laboratories at?
So our laboratories have ramped up nicely the testing capabilities. We initially started with a very manual process in the laboratory, which was quite onerous on that team. We're grateful for all of their extended efforts to provide testing to the community. But fortunately now we do have a steady supply of reagents and test kits that can be run through an automatic process in our machines. And so we're able to run a number of hundred tests a day.
So we keep hearing so much about how the antibody test is going to be so critical in this. What do you see with that, and is that going to be a game changer like most people are predicting?
So antibody tests are starting to come online through FDA approval, processes, but are not yet widely available. So there are no antibody tests yet being run in Monroe County. Those will be very important tests because antibody tests will help us understand how the human body is responding to the infection, how long it takes from exposure to develop a immune response, how long is that immune response effective in protecting a person, and it will be a game changer in understanding the epidemiology of this disease and how we will move forward into the next phase of testing the population here in Monroe County and our patients.